Any chronic disease like Parkinson's disease is a burden not only for a patient but also for family and in some way for society. And I think that the major challenge is to keep patients as possibly functioning in daily life in the means of the motor symptoms as well non-motor symptoms that should be paid attention to all of this range. So we should see patients regularly and to try to treat all these different aspects of the disease. If you mean about research, then there are, of course, research on mechanism of this disease. We know very well what happens in brain, but we don't know yet enough what is like inducing factor for this, why this disease starts. And we call these like biomarkers of disease that we try to find as early as possible, already before seeing the motor symptoms. And that is one topic of research in many centers, biomarkers of Parkinson's. Another half of such kind of challenging is how to stop this disease. Maybe we cannot stop, but maybe in any way to manage this progression of the disease. That's another part of the most high topics of research. Generally, Parkinson's disease has been taken like a sporadic disease, and not genetic, but by now we know that up to 10% of cases are in some way genetically determined. And new mutations have been found that are related to Parkinson's disease. But there is no such kind of one mutation that we could find like a basis for diagnosis. But still, it is very important to know about these familiar cases that affect families and that usually start in young age. And that's what has given us a genetical discovery by now. And it is very fast developing area in diagnosis and in Parkinson's mechanisms. By now we know well that several non-motor symptoms are evident already before start of motor symptoms, but they are not enough specific, and that's why we cannot specify diagnosis during this phase. For example, depression or some kind of sleep disorders. And another stage of the disease when non-motor symptoms may become more prominent is already advanced stage of Parkinson's disease, when sometimes they may even affect patients more than the motor ones. So finding them already in early stage, as well treating them like symptomatically in late stage, is very important for quality of life of patients. So we should pay attention and we should ask first and then to treat. Most promising areas, I still think we have two dreams. First, how to diagnose the disease already before evident clinical symptoms, prodromal disease. Many groups are working with this. We have even criteria for prodromal Parkinson's disease for research. And another dream is how to modify disease when it is already going on in progress. Is it possible in some way to change the progression? If we would solve these two topics, then we would be there to treat this disease. It's, I realize it's too huge dream, but who has dreams can do something.